Salam Sejahtera, good morning and a warm welcome to all of you, ladies and gentlemen, and also to our speaker for today, Dr. Haslina Muhammad. I am P.W. Wong, the moderator for our webinar today. Our talk today is part of a series of webinars organized by the Malaysia Productivity Corporation on behavioral insights and the application of its principles in policy formulation in order to achieve an effective and efficient delivery of public policies for the benefit of society. The application of behavioral insights has been on the increase around the world, and governments of many countries such as the US, the UK, Australia, and even Singapore, to name just a few, have used behavioral insights in the design and implementation of public policies to drive their success rate by understanding the people's inherent heuristics and biases so as to nudge their behavior towards the desired policy outcomes. In our talk today, titled Understanding Human Behavior in Practicing Life Course Preventive Care and Self-Care, Dr. Haslina will share with us the experimental study guided by the principles of behavioral insights, or in short, BI, which was conducted to understand the related human behaviors in order to design the best intervention that would invoke the practice of life course preventive care and self-care among Malaysians. This study was sponsored by the Malaysia Productivity Corporation together with the Ministry of Health of Malaysia. Before I hand over the session to our speaker, let me first introduce her. Dr. Haslina Muhammad earned her Bachelor of Science degree in Biology and Psychology from Deakin University, Australia, and her Master of Arts in Psychology degree from University Malaya, Kuala Lumpur. In 2009, she went on to pursue her PhD in Psychology at Monash University, Australia. Dr. Haslina is currently the head of Department of Anthropology and Sociology at University Malaya. She is also a senior lecturer who teaches psychology courses to postgraduate as well as undergraduate students at the university. She specializes in adolescent psychology, with special interest in adolescents' personality, health, and well-being. More specifically, her work aims to address the 4 areas of personality, mental health, well-being, and high-risk behavior among adolescents. Dr. Haslina had conducted research on mental health behavior among adolescents and assessments on the personality and mental health among college students. Her latest research output is titled What Makes Young Malaysians Healthy? Establishing the Determinants of Social Well-Being. Her main aspiration for the next 3 to 5 years is to look into ways to enhance adolescents' quality of life. During the past 1 year, Dr. Haslina has participated in several community projects, such as conducting a mini workshop on well-being for youth at the Institute Kemahiran Belia Negara. Dr. Haslina is presently a member of the Asian Psychological Association and also the American Psychological Association. I now hand over the session to Dr. Haslina. Over to you, Doctor.
Thank you, Mr. Wong, as our chairperson today. Hello, everyone. I'm glad all of you can join our session today. Although Mr. Wong has introduced me, let me introduce myself first before I go on with my presentation. I'm Dr. Haslina Muhammad from the Department of Anthropology and Sociology, University of Malaya. And the topic of my, next, please. The topic of my presentation today would be understanding human behavior in practicing life course preventive care and self-care using behavioral insight perspectives. Next. Okay, this is the outline of my presentation today. I will give a quick background on the introduction, on the background of my the concepts used in our research, for instance, life course, self-care, and health screening. Next, I will touch a little bit on the problem statement. Okay, what problem that arise that needs us to do this research. And also after that, I'm going to describe a little bit on the theory, which is nudge theory, that we have used to guide our research. And next, I will describe the methodology used in our research. Basically, there are quite a number of studies that we use in our research. And after that, I'm going to go into the describe the findings. What are the interesting findings? Okay, we found many interesting things that I would like to share with you today. And also, I will conclude my presentation with some recommendations that we have made to the stakeholders and also the other interested parties. Next, okay. Mr. Wong has described a little bit on the behavioral insights just now, but for those who are not familiar with behavioral insights, okay, I would like to define, okay, what is behavioral insights and why we use this approach in our research. Okay, the OECD, which is the Organization for Economic and Cooperation and Development, has defined behavioral insight as an inductive approach to policy making that basically combines several disciplines such as psychology, cognitive science, and social science with empirically tested results to discover how humans make choices. Okay, so this is basically the technical definition of behavioral insight. More than 202 institutions around the world has applied the approach, okay, the behavioral insight approach to their public policy, including Malaysia. Malaysian Productivity Corporation, MPC, has recognized the importance of BI in policy making, and they have set up a behavioral insights needs to spearhead the application of BI in public policy. Okay, if you can see on the screen, okay, I have put on the screen the basic framework that basically used by, that has been recommended by the OECD, which includes how behavior basically translated into intervention and also the actual change that happens in behavior. Okay, so by utilizing the framework, BI or behavioral insights can help policymaker to understand the people's or the society's behavior. Okay, so one of the BI principle is basically to conduct a pre-test. Okay, so before any policy is made, okay, they basically prefer to conduct a pre-test on the subject matters, on the subject of interest, before they can make any decision. Okay, so with pre-test, basically solutions and interventions can be tweaked or fine-tuned to a more efficient policy, public policy, before upscaling it into before upscaling the research. Okay, so with this objective in mind, MPC has collaborated with several interested parties, such as the MOH, Ministry of Health, to select possible significant issues that need further actions. Okay, so one of the issues that have been identified is how humans behave in terms of how they practice their life course, preventive care, and also self-care. Okay, so to those who are not familiar with some of the concepts that we use in our research, I would like to introduce a few concepts, which is one, okay, life course. What is meant by life course? Life course epidemiology basically investigate the long-term effects of physical and social exposures during several stages in life, in our life. As you know, in our life, we have several stages. Okay, as you can see on the slide, we have early life, adult life, and older life. Okay, so life course basically identify or recognize that all stages of life basically they are interconnected with each other. Okay, so what happens in early life might influence what happens in adult life. Okay, so that is what we mean by life course. Okay, so rather than focusing on a single condition at a single life stage, this approach consider the critical stages, transitions, okay, where differences can be made in promoting or restoring our health status. Um, by adopting life course approach means that we identify key opportunities for minimizing risk factors and maximizing protective factors that basically can help us to increase our health status. Um, so, okay, self-care. Okay, so where we know what life causes. So what is self-care? Okay, as you can see on the screen, okay, self-care is the process of maintaining our health. Okay, maintaining our health through treatment adherence and also health promoting practices, behavior and condition monitoring, and managing signs and symptoms when it occurs. Okay, currently there is a growing recognition that self-care is very important in order to increase our health status and also our quality of life, especially to those who has chronic diseases. Okay, so that we by self-care, we basically know how to have responsibility for our own health, and also we need to be actively involved in self-care activities. Okay, as you can see on the screen, okay, self-care consists of many aspects or many components. Okay, there are self-management, okay, which includes self-medication, self-treatment, and also self-examination, and also self-testing, which is self-sampling, self-screening, among others, okay, and self-monitoring, and also self-awareness, okay, self-help, self-education, okay, so all is involve our awareness, okay, of what is happening to ourselves. Okay, as you can see, there are many aspects of self-care. For the purpose of this pilot study, we only focus, okay, it's not possible for us to investigate all aspects of the self-care. So we only, we decided to focus only on the health screening. Okay? So health screening, which studies the response, okay, our response towards maintaining our health using using our self-care. Okay, so the purpose, what is the purpose of screening? Since our focus is on self screening, so what is the purpose of screening? Okay, screening basically, we do screening, okay, to improve our health and also the population health at large. Okay, our health per se and also population at large. It is the identification of diseases in an apparently healthy person. Okay, so when we go for health screening, we are healthy, so we don't expect to have any chronic diseases, but we want to know the status of our health with, okay, because there are many hidden diseases that we might not know, so we go for health screening. Okay, so screening, basically the aim of screening is to detect and treat diseases in their early stages. Okay, so the key word here is early stages. Okay, so if, as you know, if any chronic diseases, for instance, cancer is detected at early stages, it can okay, save our life. So that's why health screening is very, very important, because it is done to detect, okay, disease at an early stage. And because of this, because of health screening, we are able to reduce the morbidity and also increase our survival. So therefore, screening has been introduced in most healthcare system. Okay, so for many, many conditions. Okay, what else? Okay, so what is actually the problem that happens, okay, or that occur, that prompted us, or the MPC, MOH, to carry out this research? As you can see on the screen, okay, the statistics, okay, have shown, that worldwide, approximately 36 million, okay, 36 million people have died annually due to NCD, or the non-communicable diseases, okay, such as cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Okay, so that is we categorize that under non-communicable diseases, or NCD. 40 millions of these have died before the age of 70, which can be seen as premature death. We classify that as premature death, and according to WHO, 90% of these premature deaths occurred in low and middle income economies. But the death due to NCD can be prevented. Okay, so this is very important. Okay, the death due to NCD can be prevented by practicing healthy lifestyle. Okay, so uh, in the 11th Malaysia Plan 2016-2020, the government, okay, Malaysian government's focus was to implement measures to reduce communicable disease as well as non-communicable disease. So many programs has been invented, or have been developed, which includes the provision of preventive healthcare services and the promotion of healthy lifestyle by both public and private sectors, okay, and as well as NGOs, okay, non-governmental organizations. In the Malaysian context, okay, the prevalence of NCD among Malaysian adults aged 18 and above showed an increasing trend since 2006. Okay, as you can see on the screen, you can see that most of the NCD diseases, okay, you can see the statistic is increasing. Okay, and the upward trend basically worries, okay, the government, because one, there are many factors. Basically, what worries the government? One, because this problem can affect the quality of life of the Malaysians. Okay, we want healthy Malaysians, so that's why this problem is considered as significant. Okay, because it can affect the quality of life, Malaysians' quality of life, and also the financial burden to the government. Okay, the financial burden to government, because to treat NCD patients and also the complications related to NCD diseases could rise to 3.25 billion. Okay, so this is the figure basically that can be reduced if Malaysians know how to practice a healthy lifestyle, and one of it to go for health screening. Okay, recognizing the seriousness of the problem, the Malaysian government, okay, has initiated various programs, okay, aimed at flattening or decreasing the trend of NCD. Unfortunately, these programs, okay, programs that were geared towards life course practices such as health screening has received low intake by the Malaysians. Okay, so this indicates the needs. Okay, we want to know why. Although this, for instance, okay, as you can see on the screen, initiatives such as health a screening program, PK 14, has been introduced, but not many Malaysians go for it. Okay, for instance, for HSP program, only 19% of Malaysians actually went for it, and PK 40 only 11% went for it. Okay, so because of this problem, okay, so we decided, or the MPC, okay, MOH decided that, okay, we need to know what is actually happening that caused the low take-up rates from the Malaysians, although it's free. Therefore, the research, the objective of our research is to understand, okay, to understand and to understand what is actually happening, and to invoke the best nudge, okay, or the best intervention that would trigger the Malaysians to go for health screening or any other type of life course preventive care. Okay, so that is basically the main objective of our research. Okay, so I introduced a little bit on the theory that we have used to guide our studies, which is called nudge theory. There are many theories, okay, that basically can be applied, but we found that nudge theory can fit into the framework of our research. So what is nudge theory? Okay, so nudge theory is basically a theory that is applied, okay, that basically can be used, okay, to there are many stages, okay. We use nudge theory because it can provide a framework to see the behavior change, okay, from what has not been done to what will be done. Okay, so there are two aspects, okay, that we use, okay, based on the nudge theory, okay, which is basically the to encourage people to make healthier lifestyle without being asked to do so. Okay, we do this based on our awareness, based on our free choice. Okay, rather than trying, according to nudge theory, rather than trying to overtly change people's behavior, we want to subtly direct people down a particular path by altering their environment. We provide encouraging environment for them to change their behavior towards the positive behavior. However, we need to remember that nudges are about long-term benefits. Okay, so if long-term benefits, it's not necessary for us to see the change now. Okay, so the two indicators, okay, so the nudge theory within the self-care was applied using two indicators to see the behavioral change, something from something that is not done to something that will be done. The two indicators used were, one is the additional self-care activities which were not practiced 1 month ago, and also the health screening done in the last 1 month. Okay, because of the time constraint, it's not possible for us to use longer period of intervention. Okay, research methodology. Like I said earlier, there are many stages in our research, and because of the time constraint, we need to fit in the time frame given. So the first stage basically involve the discovery. We call it discovery stage, where we make engagement with the MOH and MPC to gain related information regarding to our research. Then after that, we go for the second stage of our research, which we call baseline stage. Baseline stage, which which I will describe later. And then after that is the intervention stage. okay, where we implement where we experiment or implement the intervention. And then the fourth or the last stage is the evaluation stage, okay, so to see whether the behavior is actually changed or not. In baseline study, basically we use interviews, qualitative study. We use interview. The target group is Selangor, because of the situations now with the COVID and also the time frame. It's not possible for us to move around a lot. So we chose Selangor as our target group. And for the baseline, we go for a sample size of 500 adults, age 18 and above. And then how we collect data, we use telephone interviews. And the mobile numbers basically computer generated. It's also it's random. It's random selection, random sampling. Basically, it's quite good. Okay, what we got from the baseline study, we managed to collect data from 517 adults in Selangor, which we interviewed by telephone. Okay, so okay, so as you can see on the screen, the baseline, okay, you can see that the objective is to basically to determine the level of voluntary health screening before we implement the intervention. We want to know whether they are aware of the health screening and how many of them actually go for health screening. Okay, so some of the things that we asked, okay, in our baseline study is the practice of self-care, whether our respondents practice self-care or not, and then whether they are aware of the government health screening program. Okay, like I said earlier, the Malaysian government is very serious about this matter, and they have introduced a lot of health screening program, free health screening program, and we want to know whether they are aware or not of this program. And then we ask them some of the possible nudges that can be used to increase the behavior, the positive behavior towards health screening, and also whether their health status at the moment, whether they have any diseases at the moment. Okay, and the checklist for health screening for the last 12 months, which include whether we ask them whether they have done any blood test, any urine test. Okay, basically the basics, okay, for health screening. When we go for health screening, when we go to the clinic, basically this is what they will ask. Okay, the doctors will do for us: the blood test, the urine test, okay, cancer screening, and then mammogram for women, and then our weight, okay, whether we are overweight or not, obesity. Okay, so that is for our baseline. For next is our intervention. Okay, intervention. Okay, so this is again on the baseline. Okay, like I said earlier just now. So what we do in our experimental or intervention stage. Okay, so what we do is, okay, based on the data collected during our baseline study, okay, so we asked them whether they go for health screening or not. So we chose only those who did not go for health screening for our intervention program. Okay, so we chose only those respondents who did not. Okay, respondents who did not go. Okay, who did not go for any health screening for the last 12 months, okay, were selected to receive the intervention. And then data from the baseline showed that out of 517, 307 did not go for health screening at all. Okay, so these are the samples that we used for our intervention stage. So out of these 307 respondents, okay, the sample was divided into 5 groups. Okay, so they were divided into 5 groups, which is control group, and then 4 treatment groups. Okay, 4 treatment groups. Each treatment group has basically a sample size of either 96 or 92, which is to our regret not many, but due to the constraint. Okay, so we have to make do with what we have at that moment, and then selection of sample for each group were done randomly. Okay, so for the intervention, we tested two parameters. Which is one on the content, okay, on the content, and also one on the frequency of the exposure. Okay, so so this is already the findings. Okay, with the objective, okay, for the experimentation stage, the objective was to determine the best nudge, okay, that can be applied to encourage Malaysians to practice life course preventive care and self-care. So we decided, okay, so there are many ways to do it, but after some discussions and some readings, we found that messages, okay, via social media has been tested and evidenced, okay, to help in nudging behavior. Okay, but okay, so out of the articles that we read, 82% of the articles on the mobile usage showed evidence that text messaging has a positive impact on the outcome. Okay, so the research showed evidence that text messaging in healthcare are largely beneficial clinically, okay, or in public health related use and in terms of administrative process. Therefore, we decided to use SMS or short message services as our nudge, okay, towards the desired health behaviors. Okay, so based on earlier findings on baseline studying and also past research, we agreed, okay, to use, we decided to use message framing theory to nudge the mindset and behavior of the Malaysians. Okay, so this theory, message framing theory, suggests that message effectiveness is influenced by two factors. One is the type of behavior promoted, and also second is the framing of the health messages. Okay, so the gain frame. So we decided that we decided that we are going to test on the content of the messages, the SMS, which with the focus of the gain frame messages. The gain frame messages emphasize on the benefits of the behavior change. Okay, so as you can see on the screen, okay, so the gain, or when you use positive framing in the wording of our content, SMS content, okay, we are focusing on the benefit. Okay, so for instance, okay, we decided this is what we use. These are the wordings that we use in our SMS messages. Kajian dari Persatuan Kesihatan Sedunia WHO menunjukkan saringan kesihatan awal dapat mengurangkan kos rawatan penyakit ini. Sudahkah anda melakukannya? Okay, so that is what we use in our SMS for positive framing. And then the next one is the negative framing. Okay, so negative framing basically emphasize the cause of failure to act. So what will happen if we don't do it? Okay, so this is what we use. Okay, 30% dari rakyat Malaysia mengalami darah tinggi dan 47.7% mengalami kencing manis. Adakah anda salah seorang yang berisiko? Okay, so that is negative framing. These are the two things that we use, and then that is in terms of the content. But in terms of the frequency, okay, in terms of the frequency, we send the we send the messages, okay, to our respondents, okay, based on their groups, okay, T1, T2, T3, and T4, okay. Those who are in T1, okay, we send them SMS that has positive framing once a week. Okay, so once a week they will get this. They got this message, SMS messages for 3 weeks. Okay, and then for those in group 2, T2, okay, again we use the content of positive framing in our SMS messages, but in terms of frequency, we blasted the message 3 times a week for 3 weeks. Okay, so the frequency of the messages increased. Okay, so for those in treatment group 3, okay, we use the negative framing content. And then in terms of frequency, only once a week for 3 weeks. And those in T4, okay, group 4, treatment group 4, we use the negative framing SMS, okay, but the frequency was increased to 3 times a week. Okay, so that is our focus. That was our focus. Okay, the content of the messages and also the frequency of the messages. Okay, so that was what happened during experimentation stage. Okay, so what we found. Okay, so this is the interesting part. Okay, based on our research in baseline study, in terms of sample composition. Okay, in terms of it's according to the demography of the Malaysians. Oh, sorry. Malays, the respondents of our study, Malay consisted of 56.58%, Chinese 25%, and India 19.57%, which reflected the population, the Malaysian population demography. And then the income group, okay, mostly it's B40, which is 60.1%, followed by M40, 32%, and also T20, about 7%. In terms of age group, okay, the age group, we divided that into 4 groups, okay, 18 to 24 years old, 22.3%. The majority of the respondents in our study consisted of those in Gen Y, okay, those who are in 25 to 39 years old, which is quite a high number, a high percentage of this group, which is about 46%. And then followed by Gen X, okay, 40 to 49%, 42 to 49 years old, which has 16%, and 50 plus years old, okay, 16%. Okay, in terms of gender, female 52% and male 47%, which is quite balanced, okay, okay. Most of our respondents are working full time, about 57%. Okay, so this is Selangor population, okay, which I have described earlier. And then, okay, in terms of what we asked them according to their practice, okay. So when we asked them about their self-care practice, yes, 64% of them, okay, claim that they do self-care, okay, they practice self-care. Only about 37% who did not practice self-care at all. Okay, so this is again, okay, we need to remember there are many types of self-care, like I said earlier. Okay, so example of self-care, for instance, okay, what we got from them, okay, most of them do exercise every day, okay, they or not every day, maybe once a week, twice a week, okay, so they do exercise, 71.4% exercise, and also involved in sports, running, jogging, whatever. And then about 60% of them practice healthy diet, which is good news. Okay, practice healthy diet, and then 7.3%. Okay, so this is quite relevant to our situation now. Okay, 7.3% practice COVID-19 SOP. Sorry, COVID-19 SOP. Only 3.3% see the doctor. Okay, and then so there are many type of self-care. So the statistic here, okay, 63.64% of them said yes, okay, they did, okay, some of the self-care practice. And then when we asked them whether they did any health screening for the last 12 months, 60% of them said that they did not do any health screening for the last 12 months. And 40% said, okay, which is quite good, okay, do health screening. Okay, so in terms of whether they are aware of health screening benefits, yes, 64% of them aware that there are many health screening benefits, okay, that have been introduced by the government. For instance, okay, they are aware of SOCSO health screening, PK, salam, what do you call it? Okay, salam PK, aware my salam, my salam, PK 14, SOCSO health screening, 28.43% aware of these programs. However, okay, a lot of them, 70%, okay, or 72% of them basically did not aware of these programs. Okay, and yeah, okay. SOCSO, yes, okay, 29%. Aware of basically, okay, many, or if you can see on the screen, it's based on the type of the health screening, SOCSO health screening, and then this one, aware my salam, and then aware PK 40, which many of them basically, if you can see, did not aware of these programs. Okay. In terms of behavior gap, okay, prevalence of a health condition, about 27% reported that they has at least one condition, okay, or one health condition, okay. 73%, okay, reported that they believe that they have no problem, okay, they have no health problem. If you can relate, okay, with the self-care being practiced just now, okay, though there is a high incidence of self-care being practiced, only 27% claim that they do have at least one of the NCD conditions. 73% believe that they do not have any conditions or ailments. This is contrary to the data from MOH, where at least, okay, 17% of Malaysian population has diabetes, 30% has hypertension, and 48% has hypercholesterolemia. Okay, so the behavior gap in this sense, okay, although they believe that they have no problem, but the statistics from the MOH told us otherwise. Okay, so basically we don't know what happened. Maybe they have it, they don't realize it because they don't go for health screening. Okay, so that these are the things that we want to know. Okay, so reasons for not going for health screening. So we asked them, okay, why didn't you go for health screening? So most of them, 50%, 55% of them, 54% of them believe that it's not essential because they are healthy. Okay, so why do I need to go for health screening? I am healthy. Okay, so they believe that it's not essential. And then 5.4% believe that, fear of the pandemic for now, they don't want to go for health screening because, of the pandemic. Okay, if we go to the hospital, we might get exposed to COVID-19, something like that. And then 20%, which is quite high, thinks that it's expensive. Okay. Although they know, okay, because maybe they are not aware of the program just now, the free program that has been introduced by the government. And 8.2% of them claim that they did it more than 1 year ago. So I have done it once, so I don't want to do it again. Okay, so that is another reason. Although we need, okay, although it is recommended that we do our health screening in basically, I think it's recommended to do every year or every 2 years. And then it's quite high percentage also, 20% claim that they are busy. They are too busy to go for health screening. Okay, so there are some of the reasons why the respondents did not go for health screening. Okay, so what else? Okay, trigger for health screening. Okay, so what makes them go for health screening? Most of it said that requirement. Okay, requirement from the employer. In order for you to get a job, you need to do health screening. Okay, so I go for health screening. Requirement from employer, requirement from the university or college. Okay, as in the university, when you want to go into university or college, you need to do you need to do health screening. Okay, so it's quite high. Okay, the requirement. Voluntary also is quite high, which is good. Okay, they are aware of the benefit of health screening, so they volunteered. They go by themselves to do health screening, and then also some of them go for health screening because they have existing condition. So they went for health screening, and then they also go for health screening because it is recommended by the doctor. All in all, we can say that health screening health screening only done when it is required or mandatory for them to do it. Okay, that is the findings from our baseline study. So this is the finding from our experimentation studies. The response rate. We are aware that the sample for our studies is not big. That is one of the limitation of our studies. Okay, but due to the time constraint and also budget constraint, this is the best that we can come up with. The response rate, we got it after when we blasted the SMS. Okay, for 3 weeks. Okay, so 7 days after the final SMS intervention, a follow-up study to measure any behavioral change was conducted. All 307 respondents, including the control group respondents, were contacted by telephone to reinforce evidence-based intervention. No SMS were sent to the control group, but we feel the need to follow up with them because we want to counter check if other environmental intervention may have affect the response. For instance, now health issues are very hot. Okay, so and during this period of MCO, a lot of information of healthcare has been given by MKN, so maybe this also another factors that can nudge people to go, for health screening. Okay, as you can see on the screen, okay, for control group, out of 61, for only 44, we managed to get callback sample for 44. Only 44 people responded. For group 1, 53 people responded. For the group 2, 43, and then group 4, group 3, 77% response rate, and group 4, 69% response rate, which is acceptable. Okay. From the follow-up call, Okay, so we asked them whether in the follow-up call, we asked them whether they did self-care activities for the last 1 month and which they have not done before. Okay, and whether they did any health screening in the last 1 month. Okay, for control group, okay, this is we need to remember that okay, before this they have not done any self-care activities. Okay, but after the intervention, after the SMS, for the treatment groups, okay, not for the control groups, we can see an increase. Okay, for instance, for group 1, treatment 1, positive with, if you can still remember, using positive framing in the context, in the SMS context, which was blasted once a week. Okay, 21% reported they did self-care activities for the last 1 month. And they did health screening. 5.7% of them did health screening for the last 1 month. For group 2, okay, positive framing with the frequency of SMS blasted for 3 times a week for 3 weeks. Okay, 19% claim that they did self-care activities and 9.3% claim that they did health screening. Okay, so which is good, from nothing to at least something. Okay, and for group 3, which has the negative framing content and the frequency of SMS, okay, once a week blasted to them, 15% claim that they did self-care activities and 4.2% claim that they did health screening. Okay, and for group 4, which has negative framing and the frequency of 3 times a week, which is this is quite surprising to us. Okay, 61%, okay, of the respondent claim that they did self-care activities for the last 1 month, and 21.4% of them did health screening. Okay, so we can see the high percentage in this group. Okay, the group 4, the treatment 4 group. Okay, which has negative content, negative framing messages, and the frequency, and a lot more frequency of SMS blasted to them. So what we can say from this study, okay, but we have to be very cautious. We have to be very cautious in concluding our findings because of the limited number of sample. But what we can say at this stage is, okay, based on our results, we can say that we can detect positive behavior, okay, after the intervention for all treatment groups. Okay, so for all treatment group, there are changes. Okay, not to say changes, there are positive behavior occurred. Okay, after the intervention, which is none of them did any health screening before. Okay, or none of them did have self-care activities before. Okay, so which is a good finding. And what is interesting here again, okay, the significant behavior change on content on negative framing and higher frequency. Okay, so this is the detailed percentage. Okay, what we got. Okay, percentage of those who saw the SMS and actually did health screening. Okay, group 1, okay, do not do health screening. Okay, this one group did not do any health screening, 0%. Group 2, okay, positive framing 3 times a week, 14.3% did the health screening. Group 3, negative framing, responded, okay, to post survey, 20%. Group 4, negative framing, okay, responded with 3 times, responded, okay, to post survey, 28% of them did health screening. Okay, and then okay, sorry. Okay, in terms of positive framing, okay, in terms of positive framing, those who seen the SMS, okay, did health screening 10%. Those who seen the SMS, okay, negative framing, who actually did health screening, okay, 25.7%. Okay, although uh, there is a quite high percentage of those who saw SMS but did not do health screening is quite high, but we can still see the maybe because of the small sample, okay, but we can still see the changes in the behavior. Okay, so what can we say about our research? What can be said about our research is that, okay, based on the findings of our research, we concluded that, okay, there is basically SMS can be used to nudge people towards practicing, okay, life course self-care, okay, but there are few limitations, okay, which limits, okay, which limits our research, okay. So although with this limitation, we decided, okay, or we want to recommend, okay, we have suggested few recommendation, okay, as you can see on the screen. What is important here, okay, although we can see the changes, not the changes, we can see the direction of the behavior from not doing anything to doing something, okay, from not doing anything to doing something positive, okay. We recommend, okay, for the research, or for this, we recommend to the stakeholders to undertake an upscale study with a large sample, okay, with an increasing sample size of at least 3,500 to validate our findings, because this is pilot findings with limited sample, okay. So it is good, okay, it is recommended, okay, to undertake an upscale study so that our findings can be validated, okay. And then in terms of formulating the words in the SMS, okay, we suggest, okay, or we recommend to conduct a focus group to draft the best wording in terms of message framing content, so that we can test, okay, which wording works better, okay, also to validate the findings of our studies, and also the best frequency exposure per week. Okay, so what we did was once a week and 3 times a week. So maybe 5 times a week, or 4 times a week will be better or not. So that is something that we need to find out. Okay, and then we recommend to utilize SMS for future communication, as with digitalization and the concept mobile first is in everyone. So we can say that SMS can be used as our medium of communication, like what has been done by the MKN nowadays. Okay, so communications need to be consistent and regular. Okay, as can be seen, out of sight, out of mind. Okay, once a week, 3 times a week, we can see the difference there. Okay, so communication needs to be consistent and regular, because our findings show that frequency plays a role in the behavior change. And for healthcare, so this is also important findings. Okay, for healthcare, negative framing seem to work well as a form of scare tactic or shock therapy. Okay, so this is perhaps being compounded by the current pandemic, where scare tactics are being used to ask people into action, okay, to encourage people to do action and to increase their awareness. Okay, so it is important to upscale the experiment to understand the people fear and concern. Okay, understanding on the people fear and concern need to be done to ensure a much more effective message. And then the interventions used must be verifiable with actual data from health institutions. Okay, MOH perhaps needs to have a smaller group to attest the effectiveness of any type of message, and and this has to be translated into action by target group. Okay, so these are some of the recommendations, okay, based on the findings of our research. It is hoped that by upscaling this research, we can find more significant findings that can be used to help people, to help Malaysians, okay, to achieve a good quality of life or a better quality of life. With that, I conclude my presentation, and I would like to thank the listeners, okay, for listening to my presentation today. Thank you very much.
Thank you, Doctor. We have one question posted in the Q&A box, so I'll relay that question to you, Doctor. The question is from Nancy Jones, and it goes like this. How aware are Malaysians on self-care and the importance of quality of life nowadays?
How aware? Because if you ask me, I think 2 years ago, I can say that, okay, we are the Malaysians, as can be seen in the findings of our research, the Malaysians are not that aware of our health status. But because of the situation nowadays of the COVID-19, where health is our most concerned matters nowadays. So I think the level of awareness among the Malaysians regarding their health status, or their health status are increasing.
Okay, thank you. One more question from Mr. Leong Kin Chung. He asked, can the government make it mandatory for Malaysians to undergo health screenings at the ages of 40 years and above?
To answer that, to make it mandatory, it involves many things. For instance, the budget by the Malaysian government. So, I think that question, okay, we can need to be asked to the person which is more, I think need to be asked to MOH, need to be asked to the relevant parties, because in order for us to make it mandatory, it's good to make it mandatory, but many factors that need to be considered. For instance, the budget, and then also the willingness of the people to go and undergo health screening, So many things has to be considered regarding making it mandatory.
Yeah, but the government, our Malaysian government, has already done quite a number of initiatives, right? Introducing the Peka B40 soft health screening, and also My Salam as sort of like incentives or motivation for certain segment of the population to go for a health screening.
Yes.
So I guess it is the awareness of this particular target group to take up these initiatives, which will benefit them, and of course also benefit the government in the long run, especially our Malaysian healthcare system.
Yes, exactly.
I guess how to make them more aware and how to motivate or nudge them towards wanting to go for these sort of free or subsidized programs for them, for their own benefit. Probably, like you say, doctor, using some scare tactics would help to move them towards taking up this preventive care.
Yeah.
Okay, I have another question here from Mr. Howard Ken Cartel. The question is, how self-care program can help healthcare workers who experience depression, who are experiencing depression during this time of pandemic?
Basically, okay, if we talk about depression, the first step is to recognize, okay, to know you are in depression state. Okay, so that is the first step. Most of us, we don't really know when we are depressed. Okay, so self-care practice, the one who is having because depression is not under NCD. Okay, depression is how do you, in terms of self-care, you need to know your own self first. You need to know your body, whether, okay, what is your mood today? How do you feel? That is something that we fail to recognize. Okay. So in terms of self-care, you need to be able to understand your emotions. Okay. You need to be able to understand how your body works. That is in terms of self-care. You know, you need to know yourself first when we talk about depression, because when you don't know, some people, they don't know they are in depression, and they refuse to go for help. Okay, so okay, I'm sad, but I think this is, it's just sad, you know. And then yeah, although the sadness feeling has been going on for months. Okay, so they don't really know the situation of their the situation of them, their own situation. In terms of self-care, okay, what I can say is, okay, you need to understand your emotions. Depression, especially when dealing with depression, you need to know your emotions. You need to know what is happening to yourself, to your emotion, and then when you recognize that, you go and seek help.
Okay.
That is my advice. Yeah.
Okay. Thank you, Doctor. I'm looking at the Q&A box. We don't have any further questions from any of the viewers or participants today. And looking at the time, we are 5 minutes after 11. I think we have come to the end of our webinar today. So, Doctor, before we end our talk today, is there any closing advice or comment from you to our viewers?
Stay safe, everyone. Okay, hopefully we are able to go through this pandemic time. And I would also like to thank MPC, Ministry of Health, you know, for their good initiative in conducting behavioral insights. Okay, and for their good initiative in helping the Malaysians to achieve a very or better quality of life.
Okay. Thank you, Doctor. Well said. So, ladies and gentlemen, we have come to the end of our webinar today. And I thank Dr. Haslina for the very interesting and enlightening sharing on the study and application of BI in influencing the behavior of Malaysians towards practicing life course preventive care as well as self-care, not only for their own benefit, but also for the benefit of the Malaysian healthcare system in the long run. And I thank all of you who have joined us this morning for taking precious time out from your schedule to participate in this webinar, and hope that you have gained some salient takeaways from it, and also hope that you will join us for more webinars in the future regarding BI and the application of BI in public policy making. In fact, we have another one next Friday, I believe. We have another webinar related to BI next Friday morning. And it will be focusing on, understanding human behavior and how to encourage people to use public transport in the Klang Valley in Malaysia. And I believe the week after next, we will have another webinar on BI related to the BI framework, on the measurement and also evaluation of results from experimentation using BI methods. So with that, I wish everyone good day and also productive rest of the week ahead. Like what Dr. Haslina mentioned, stay healthy, stay safe, and especially stay productive. Goodbye, everybody. See you all again next time.